dosing and titrating and the chemistry that goes into this is all top-notch. It's been tried and measured, it's quantitatively specific, and I am proud to say that I would use these folks to titrate medicines for any of my pediatric patients. There are titrations of the oil taken off of the plant. It's measured through the labs and given a specific amount of how much THC and different CBDs are present in that concentrate. So therefore, it's used as a titration to dose very little kids, or to increase to the point that therapeutic values have been met. All of it being measured in the milligrams per ml, very specific, reproducible numbers.
When I get a new client who is a pediatric client, the first thing I do is ask them for the dosing recommendations from their recommending provider, their doctor. They usually come with those in hand from a clinic like Integrate, for example, or from Dr. Mary Callison, who will give specific dosing recommendations to the caregiver so that there is oversight as far as, and guidance. And then I will formulate a tincture based on those recommendations. So a tincture might be CBD of 40 milligrams per ml, or it could be THCA at 10 milligrams per ml, or it could be a 3-to-1 ratio of CBDA to THCA at 100 milligrams per ml. In that way, I'm sort of a compounding pharmacy, and what I really call myself is a cannabis herbalist. Folks who found us would come to us after having tried a tincture from somebody or a preparation from somebody that really, they couldn't tell me what was in it. And that was an issue because you didn't know what in it was working or not working for the client. So it's very important to always have repeatability and accuracy in what you're doing to be able to tell someone what is in their medicine. And also it's a safety issue at that point as well, because if you have a child with seizures who's responding positively to something and then you take that away, I mean, that's a heartbreaking moment. So if you're going to serve pediatric patients, you really need to have the aspects of safety and repeatability intact, and honesty too, transparency, all of those things come together.
My name is Susan Meehan. I helped establish an organization here in Maine called Maine Children for Cannabis Therapy after I moved here with my daughter, who was then 11 years old in 2013, from the state of Connecticut, which was not legal to treat pediatric patients in. So it was a big move on our part, but we were out of options with Cindy May at the time. Cindy May, since her 10-month vaccinations, had unrelenting seizures. They were uncontrolled by pharmaceutical options. She had tried 23 different anti-epileptic drugs in combination and alone, and she had tried specialized diets to treat seizures, like the ketogenic diet, the modified Atkins diet. And she had a VNS, which is an electronic device that's sort of like a pacemaker for the brain. It's a vagal nerve stimulator, and that did help Cindy May a lot, but when she had it installed, she was having over 20,000 seizure spikes a day. So she was having 20,000 of these small little jolts through her brain and her body that lasted a very fraction of a second. But she was also still having 1 to 4 generalized tonic-clonic seizures, or what you might classify as a grand mal seizure in layman's terms. She was at that time she was on 5 different medications and bound to a wheelchair from the side effects of those medications, not because she couldn't walk. She was once a walking, talking, happy little child before the seizures became really devastating, and before the medication levels were so high that she was having trouble eating. She could hardly walk. She had no balance. She was asleep more than she was awake. Probably about 20 hours out of a 24-hour period, she was asleep, or at least not really responsive. So you have these very powerful classes of medications that perhaps save a lot of lives when they work, but perhaps are also overused and are extremely toxic in even low doses compared to cannabis, which we haven't found a toxic dose yet. And it's a shame that that is a last resort versus a first resort. We started cannabis very fast after we moved here. We had an appointment with Dr. Sulak from Integrate Health before we moved here, and so her paperwork was in process. We arrived here in late November of 2013, and before Christmas time, Cindy May was outside playing in the snow for one of the first times in her last few years, really, that I can remember, because the cold temperatures and the bright white light of the snow often triggered seizures. But we have video footage and photographs of her playing with her sisters and sledding all the way down the hill all alone and being so far out of reach from me. But it was comfortable for the first time ever that I was pretty sure that she could sled down that hill and get back up and not require a treatment for a seizure. It was just a miracle. She finally was catching snowflakes on her tongue and aware of her surroundings. So with her not so drugged, the difference in her ability to play and interact was phenomenal, but also that the cannabis was already working so well that she could be outside playing in the snow and not trigger a seizure.